It is always a great time to be familiar with CPR and other related health safety practices, but recently there's actually been a couple of changes to CPR guidelines. So I'm joined here in studio by Gwen Fosh. She's a volunteer with the American Heart Association and a longtime pediatric cardiology nurse. Gwen, thank you so much for being here. Again, we have done this before, but now we're here to talk about some changes. Nothing too crazy, but it's good to give this information out, especially as folks are going to be gathering this week. I'm sure any time is a good time, though, to talk CPR. So let's start with the changes. I know you are obviously a pediatric nurse, and one of the big changes to it is how to do CPR on babies and small children. You want to start us off with that?
Sure. I think all the changes were done through an international group of authors, and we were able to make changes through the whole systems of care for all ages, and make sure that hospitals, from emergency pickup with an ambulance all the way till after a cardiac arrest, and recovery.
Yeah, that whole process.
Yes. So, and then there was focus on high quality CPR for all kinds of populations. And babies are one of those special populations.
Yeah.
So we used to have a method of doing the chest compressions by using 2 fingers on the sternum. That has been found not to be as effective as either using your thumbs around the baby's chest or one hand to get better circulation. The other thing that we know is babies and small children like to have breaths. We talk a lot about hands-only CPR, where all you're doing are the chest compressions, but babies and small children recover better, do better, if we do give them some mouth-to-mouth breaths. That said, if you don't know and don't feel like you can do that, the most important part are the compressions.
Yeah, and we talked about this last time. We're going to talk about it again. Just trying to do something is so important, rather than being like, oh no, I'm going to hurt somebody. Attempting is great.
Absolutely, and that was another focus of the new guidelines, is what about the lay rescuer in out-of-hospital cardiac arrest? And really the main things are do something. Yeah. So recognize that somebody has had a cardiac arrest, or you think so, and if you think so, begin to rescue with CPR, call 911, start that chain of survival, and get the action going. If somebody doesn't need CPR and you're doing it, they'll let you know. It doesn't feel good. Right. So, be aware of where defibrillators are. I have one right here, and the more we can be aware of where they are, just in case you need to be the one that runs to go get it.
Go grab it. And I know where ours is here at WZZM. It's got a big sign, but not everybody knows where, in different buildings, different scenarios. So just familiarizing yourself with that can be great.
Absolutely.
And always good to just know how to do CPR in general. Nothing has really changed when it comes to the adult technique.
No, not really. And I think really just focusing on making sure that you do something. And that's a big reason why University of Michigan has worked with Project Adam. And also with the Department of Health and Human Services for My Heart Safe Schools. We know if we teach teachers, coaches, and make that population aware of CPR and AED use, as well as the students, which it's a high school graduation requirement in Michigan to have been trained in CPR and AED use. So if we can do that, we're making whole communities safer. And they can take that knowledge out and teach others and make your home safer, make your place of work safer. So learning CPR, we'd recommend everybody.
Yeah, starting in that school community and expanding from there.
Yes.
All right, we have a couple of minutes left, so why don't we're going to do a brief demonstration on just CPR for adults. And I remember this from last time. You have to push a lot harder than you think. That was my main observation.
Yes, and these mannequins do have a little clicker, so if we're compressing hard enough, we'll get a clicking sound.
And it's the base of the palm right in the center, correct?
Yes, right. This on the mannequin.
Obviously, there's a nice little spot.
Yes, but between the nipples and right in the center of the chest, and that's true for women, pregnant women, children, anybody. That's the truth. So,
see, and I'm not doing it hard enough.
So it really does take a fair amount of work.
Oh,
you're doing it.
I got it. Woohoo!
Yes. And you want to do this at a rate of about 100 to 120 beats a minute. And you want to have somebody else who can come over and take over for you when you get tired.
Yeah, I'm sweating.
If it's a child and you want to give breaths, and you're by yourself, you'll do 30 compressions and then 2 breaths. If somebody's working with you, you can do 15 compressions and 1 breath by the person doing the breathing. And that's better for children. Also, that kind of breathing is important for somebody with an opioid overdose because the respiratory system is what often closes down with that kind of overdose. So we do recommend, too, with your defibrillators, think about having naloxone or Narcan available as well. Yes, that was
another sort of update to the guidelines.
Yes.
I know we sort of did just a very brief demonstration, but if folks want to learn more, look into classes, demonstrations.
Absolutely.
Where should they find that info?
You can go to the American Heart Association website, and there are different ways of doing the classes and learning more. So.
Perfect. All right, Gwen, we so appreciate you being here. We have run out of time. I know we brought the defibrillator. We ran out of time, but we know that you do so much great work. We so appreciate you being here. Again, you can hop on AHA.com to learn all of that information, which is so great. Go to a class yourself. Hopefully this was helpful, and thank you for being back.
The defibrillator will tell you what to do. Yeah, so even though we didn't, the defibrillator will tell you what to do.
Gwen, thank you so much.
Thank you.
We will be right back with another